Pink, like I said it was a minor injury that couldn't have led to somebody's death. You understand? So everything got complicated.
Classy,
I don't believe that. I don't believe that.
Pretty
because you know what? No, listen to this. If that injury was so minor, why did that nurse need to come to treat it in the first place? It shouldn't have needed to be treated if it was that minor.
Okay, let me tell you something, Pretty Pink here. People sustain injury, and it's just minor. Just minor. Just minor. Just minor. Just minor. Just minor. In the morning, and the pain became excruciating that you now.
Okay, so that's when I would have been going to the hospital. You think I'm gonna sit there being in excruciating pain?
Okay, that's fine now, but Mohbad did not go to the hospital. Do you get? So if you you would go to the hospital. You would carry yourself because you want to live, because you are in pain. You would take yourself unless you are unconscious. All right? You would go to the hospital. Okay, you wouldn't wait for someone. I wouldn't wait for someone to take. I'm going to go to the hospital by myself unless I'm unconscious. So that's the case here. Does it make sense?
Right, so what led up to him being unconscious? That's what I'm trying to figure out. So if he was unconscious, how did the nurse kill him? That's what I'm trying to figure out. It makes no sense.
Classy, over to you.
You're not, Pretty Pink, you're not getting the point.
I don't get the point. I don't get the point, and I'm not going to get the point. You know why I'm not going to get the point? Because it's still stupid.
Why?
It's still dumb, no matter what you say about it. It's just the fact of the matter that if that man was in pain like that, they should have took him to see a doctor.
He's a baby here.
Okay, so
they should have cuddled him. They should have put him in a cot, like in a baby cot.
Yes, they should have. Yeah, they should have.
No, I'm asking. He's a baby. He got injured. They should have put him in a baby cot.
If he's not a baby, then guess what? Well, guess what? When they turn come, I hope they feel the same way.
Pretty Pink. I want you to understand the fact that Mohbad is actually conscious, and he insisted he doesn't want to go to the hospital. So they don't have a choice than to listen to him at that point.
I thought he was unconscious. You said he was unconscious.
No, it was after. You are not. That's why I say you're not getting the point.
I don't get it.
After the injection was administered.
Oh, that's when he became unconscious.
Yes. So during that time that he was insisting he's not going to the hospital, they can't do anything at that point. Because he's talking to them, he's telling them what he wants.
Oh, you said he told them this at the hospital or the nurse?
You said what?
You said who did he say? Who was he talking to?
He was talking to his family members. He was talking to his wife.
Oh. What was he saying?
I heard he doesn't want to go to the hospital. He's having phobia. He feels hospital is not safe for him because of his past experience. So we can't really blame anybody for that.
Right. So when did he started saying he didn't want to die? Because I was told he was begging not to die.
There's nothing like that. Pretty Pink, I have never heard such thing from the horse's mouth that Mohbad was begging that he doesn't want to die. Because immediately...
There's a video like that, classic. For the DNA.
That's a different video.
Yes, you let her to know. That was another case. Not that there's nothing like that. You let her to know that is for another case.
He's actually talking about that day that Mohbad was injected.
No, this classic. She has so many information. And look at what Papagano say. Who should keep quiet so that I explain to her. She has so many information. You let her to know that okay, this one is for So it doesn't have to do with this one. Oh. But you tell her there's nothing like that. You understand?
It's juices.
On that particular day.
Classy babe, wait.
On
Did you
that
say something like
day.
it was on DNA that he was begging? That was a different video.
NDLA.
I never said this one.
Oh, sorry. I thought I heard DNA. Yeah. It's a different video now. It wasn't about
that's what I'm saying. That she should just have explained to her that one is another case.
I don't even know that's what she's talking about. I don't even know. I don't even know that's what she's referring to.
Explain to us.
So, Pretty Pink, that video you saw was even a different video entirely, because if you look at that video very well, you see that Mohbad was actually on a low cut with a tinted hair. But when Mohbad died, Mohbad was on a bridge. So it was a different time, different period entirely. You understand what I'm talking about? So that time was when it was under the record label that he had issues with. So that video has been for 2 years ago. You understand? It's not a recent video. So do you have any other question?
In that video, he still went to hospital. He never has phobia for hospital. He was even crying on that bed of hospital that, please help me, do not let me die. But suddenly now, after
that video that he insisted.
So after that,
he has a personal nurse.
Wait now, it's classic. You explain your own, please.
First of all, that nurse is not supposed to be giving injections.
Yeah, look at
exactly.
Exactly. Pretty Pink. Now you get the point.
Pretty Pink. That video that
the nurse, this is all done.
Wait now,
the nurse is not supposed to now. Wait, now we are the one interacting with her now.
Yeah, now you say now you can't continue forever now. There's some place you are omitting. Let me make her to understand that.
Because let me say something. Juices, they said it now. They said he doesn't want to go to hospital now. Abi, were you there?
They said what?
They said it now that he didn't want to go to hospital.
No. You look at what I'm saying, Sandra. Look at what I'm saying. The picture that the video that we watched, that Mohbad was in the hospital crying for her life. That please save me. Do not let me to die. He was there. He never had phobia of going to hospital at that time. It was during this incident now that he has phobia of going to hospital.
And you can never tell. Phobia has to develop at one point. You don't know at what point.
That is what I'm trying to explain to her.
We are not trying to explain this. We are intellectual people here. I am not a doubt.
When you are saying like that, it ain't gonna be no phobia about going to the hospital. He would have went to the hospital right away.
He has phobia for not going to hospital, but he was once in that hospital crying for his life.
Things happen at some point now. At that point, he was crying. Do you know what? This is what happened to him in that video that he was crying that he didn't want to die. This is what happened to him.
It's not what he was claiming that they gave him more water at the NDNS, that they gave him water to drink.
Okay, he has already drank the water. He has already ingested something in his body. Right?
And he's feeling that pain. Yeah.
Juices, hold on. Juices, calm down. Fala Bale. Abi, Fala Bale. Calm down. He's already taking water. And he's not, he doesn't know he think it's poison.
How much did they pay you? Classic Gloria.
This one that he's sustaining.
Classic Gloria, how much did they pay you?
Hey, Sandra, let me ask you a question. I'm not saying that it's the same thing. But that kind of man that can carry himself to hospital that wasn't having phobia, suddenly he has phobia. Wait. Let me answer her. If they didn't put the word phobia there, they said, he said it's just a minor case, it's going to go. It's another different case. Okay. But the word phobia, and that's the way.
Let me ask you something. Jesus, when that thing happened, NDLA, can you please Google it and check the year that happened? And when Mohbad died, what is the difference between that year? Anything might have changed. Change is a constant thing. The only constant thing in life is change.
Well, you know, we also saw one picture, one video, Sha.
Wait now, you are talking now.
That prime boy follow him to
Can I ask y'all a question, though? Did they ever say what was the type of injection that lady administered to him?
We don't know.
The lady gave him. That we don't even talk about. The lady gave him tetanus IV. Like the lady gave him tetanus IV. Who anybody would have died.
Right, that's not an IV.
Tetanus toxin on IV.
Shot.
Died.
Right, no, tetanus is supposed to be a shot, not an IV. So somebody
exactly. It was administered through IV, which is
give anybody that you
react like that cut he had to develop into an infection. That man had an infection, so why would she be giving him a tetanus shot instead of giving him antibiotics? That's why she should have had.
She also gave him antibiotics. She also gave him antibiotics. She gave him antibiotics, she gave him tetanus injection and paracetamol. So if she gave him
something too, let me
that's why he had that allergic reaction. Too much.
Wait, standing. Let's put this correct. Are you saying that the nurse gave Mohbad tetanus injection IV or intramuscular IM?
IV.
I think it was IM. I think it was IM, not IV. Let's play it.
It was IV.
No, according to...
Let's listen.
Let's listen. We have done this with so many different doctors and nurses. This is not the first time we are hearing that. I'm playing it right now. Just wait. It was IM, I'm sure, or whatever. Let's see. Because when they assessed it, whatever the nurse gave to Mohbad, they said it was okay. I mean, I just reacted to it, not because he gives the wrong thing.
You've heard it now. What are you waiting again now? You've heard it. Travenos is IV.
Wait now. I'll let him
Okay, I'm not Oga.
Other expert opinions and witnesses' statements corroborated her admittance. Her action of administering doses of tetanus toxin, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous on Mohbad, and his residence, that's Mohbad's residence, on 12 September 2023. Immediately triggered the reactions, including vomiting, goosebumps, and convulsions.
Okay, so after he...
Wait.
Recorded. Private that he is inspired to attend the concert in Korea on 10 September 23, and in an attempt to contract including their physical growth. Mohbad kids broke the rear side glass, causing him injury on his right hand. For those of you that are interested, look at this picture. That's the picture of the vehicle, the damage that led to the injury on Mohbad. Then you can start please.
This is the Nigerian police investigative team.
Mr. Soso Someremo is the show promoter who invited Mohbad to perform at Itíôn.
Police said there was a fight in the show. The show promoter, the organizer, said there was no fight in their show.
Okay.
To promote his products, the general meters, on the night of 10 September 23, where the fights that led to the injury and subsequent change of events started from. He has given detailed statements. Mr. Omowummi, Raphael, aka Zlatan, deceased neighbor who said he was used to rush into the hospital when he became unconscious. Dr. Joshua is the medical director of Karimot Hospital in Lekki, Lagos, where the deceased was taken to and declared as confirmed as brought in death on 12th September 2023. Dr. Deborah Oluwatosin is the medical director who was on duty, and he was one that certified the deceased death of the day he was brought in at about 15-20 hours. Miss Fajulu Semikombe, Miss Abbas Aminat Sabiola, and Mr. Oluwajobi Emmanuel, they are all staff of Karimot Hospital who also witnessed when he was brought in there. Dr. Ogwala Chigozie is the director and the CMD of Parents Medical Care in Lekki. When they took him to the first hospital in Karimot and was certified there, his family members and friends that took him there were not convinced. So they took the body from there into Paris Hospital, where he was recertified as dead. Then Dr. Tilitope Maxim Olumuyiwa, he is the medical director of Cornerstone Hospital at Kote, Ogun State, where the principal suspects claims to have been trained as an auxiliary nurse. The written testimonies of the witnesses are likely of high evidential value, and they have aided in establishing the sequence of events leading to the death of Mohbad, the identification of the suspects, and the roles each played. They have also aided in gaining clearer insights into the allegations of assaults and bullying leveled against Samari and Naira Marley. Suspects. 5 suspects have so far been identified, arrested, and detained, and interrogated on their alleged roles in the sequence of events that led to the death of the singer. The summary is as follows. Miss Faye Sayo Ogenebe is the auxiliary nurse who was contacted and invited by Yoruba Misari, aka Spending, a friend of Mohbad, on 11 September 2023 to treat the singer and the deceased residents in Lekki. She eventually came on Tuesday 12 September 2023 and administered injections, which have been used to have occasioned the chain of reactions that directly resulted in the eventual death of the singer. She is the principal suspect of Mohbad. She acknowledged that it was the injections that she administered on the deceased that triggered the reaction which eventually led to Mohbad's death. Other expert opinions and witnesses' statements corroborated her admittance. Her action is carrying doses of tetanus toxins, paracetamol, intravenous, and centrazone injection, which was also administered intravenous on Mohbad and his residence, that's Mohbad's residence, on 12 September 2023. Immediately triggered the reactions, including vomiting, goosebumps, and convulsion, that eventually also resulted in the singer's death. This criminal liability is further heightened, granted in evidential facts that as an auxiliary nurse, she is not qualified to administer such medications or function as a qualified nurse. She also did this in a non-clinical environment and in a professionally negligent manner that negated standard medical protocols. 2. Mr. Yoba needs to be legally spending. So,
Papa, you know, you told that you put your money time that is to see, but give me power. Also, what jeba?
if you saw the opportunity in the death of the sinner, this action invites the person not to him as an auxiliary nurse to attend to the disease under a non-clinical setting. Occasioned mobile deaths is being held for conspiracy to commit felony. Ibrahim Oluwatosin Owoduni, aka Karimot, is a childhood friend of Mohbad. He attended the show at Ikorodu in Mohbad's company on 10 September 2023. At the end of the show, Mohbad and Ibrahim were engaged in a violent fight, during which Mohbad was injured. The management of the injury subsequently resulted in his death. So he's been treated as a suspect. Something.
All right. Now we have got enormous information. I want to start by asking this question to Sandy, who is in the health center or whatever. Sandra, let's come back to you. Are you saying, and to every healthcare or Arrow registered nurses who are here, are we saying that administering a tetanus injection intravenously that is dangerous? And are we saying that tetanus injection cannot be administered intravenously? Is that what we are saying? I want to be sure. Sandy,
Yes. Yes. Actually, Papariano, if you don't give tetanus toxoid IV, you should give it intramuscular. In fact, you should give it at the vastus lateralis muscle on the thigh. That is the preferable site for that injection. Okay, if you give it IV, it's just like, just doing the wrong thing. There are ways that you should administer medication, and there are reasons why these are the ways you should administer medication. If you go the wrong route, the patient is going to struggle, the patient is going to react, and the patient's life is going to be at risk. First of all, the nurse gave that injection IV. On top of that, she gave him ceftriaxone IV. She gave him paracetamol IV. In what doses? She is a quack nurse, she's not qualified. And do you know why the police said in a non-clinical setting? Because if there's a case of emergency, there was not going to be any way to save that boy. That's why I don't know how everybody is seeing this thing, but this is a simple case of negligence.
Now, wait, let me give you this from World Health Organization. Okay. It says, yes, tetanus injection can be given intravenously. Tetanus immune globulin, that's TIG, also called tetanus antibodies or tetanus antitoxin, can be given intravenously or intramuscularly. The World Health Organization recommends TIG as soon as possible, and the dose depends on the preparation available. Is that a correct statement or wrong statement?
I don't know where you're reading from, Papariano, but I guess you're on Google. If you want to get an accurate, you should read from a medical journal.
It's a medical website. It's a medical website. It's an MIT medical website. Yeah.
Okay, now how do you know the dose?
The medicine she gave him at one time, was that the reason why he had the reaction?
What did you say, pretty pink?
Now said find out if all three of the medicine she administered to him at one time.
That's what I'm saying. In what doses? And remember, Mohbad is hypertensive. Like there's a background of hypertension. Patients with hypertension are treated with care. Their doses aren't going to be the same with someone who doesn't have high blood pressure. And now, does this nurse have the medical history of Mohbad?
Yeah, but Sandra, you are not talking of doses initially. You are talking of it that she, injected her intravenously.
Yes,
That's what you are talking about.
tetanus should not be given IV. I said to Papariano, listen, Juicy,
They are working together.
I said,
They're working together.
I said Papariano, I do not know where he's reading from, but Juices, have you ever had tetanus toxoid? How was it given to you, Juices?
No, I have not really experienced anything like that.
So you can't know. If you have any medical professional, a doctor, a nurse, call the person. If any of them is here, I'm not speaking about Mohbad, I'm speaking about generally. Let's leave Mohbad now. You cannot give a patient tetanus IV. How?
Don't forget the black nurse, don't forget.
It just read it out from the.
I don't know where he read that from. I'm telling you. You cannot just read anything.
You can't just Google things like that. Medical terms doesn't work that way.
You know me, I don't know how to. I know what I'm saying. Like, I'm not just saying.
Even law step, they will tell you that you go and look at the black book or something.
Okay, Juice, law and medical term, law and medicine is not the same. Medicine is about life and death.
You didn't get what I'm saying, Sandra. I'm on your side this time around. I'm saying, look at what I'm saying. I say, even in law, they will tell you that don't just look at Google. Go and Google on a black book of law. But in this case now, like Papa says, under medical stuff, that's where he went to
World Health
read it.
World Health Organization.
It's not just ordinary Google. It didn't just Google. You understand what I'm trying to say? It didn't just Google.
Okay, so Juices, you're trying to say that you can give tetanus IV because
Sure, yeah, you can give it.
Based on what he read out.
It's all right.
I'm not the one that said based on what he read out. But the only clause that they put in what he read out now is dose. It's only dose. To look at the dose that they are
it is usually given. It is not me. I have not. Even when this thing happened, I have somebody that is a medical doctor. The first thing he asked me was, what is the dosage of what the nurse administered? That assuming it was in a clinical settings, that they would have given him an antidote to what he reacted to.
Exactly. Classic. If you argue on that, according to what Papagano read now, the clause that was also there was dosage and the environment at which it was given. They are not talking of how the thing enters.
Or the party was right. Juices. IV is very wrong for somebody that is even hypertensive.
Now,
when you read, let me tell you, medical terms. Okay, when Papagano was reading it now, did they state somebody that is hypertensive or not?
They did put.
You can't read medical terms like that. It doesn't work that way.
That's what
it is not normal English.
Wait. See, if there is a clause, they will have put in it because for the fact that they put clause of dosage there, they will have put a clause of that. If somebody
they can't put all those things in Mr. Madam. Forget about this argument online. If you have somebody that is a medical doctor, like your younger ones, you have as in somebody that can easily
there are some things that there's no what
don't worry, I will ask my younger sister tomorrow. So
just ask the person. We don't need to argue blindly on such things.
Yeah, but he read it from book. He read it from from a read.
You can't say what is reading now. It's just as if when I was having some reactions, I should go and read it online. Are you telling me that what I read is absolutely wrong?
No, sometimes you get an idea about it. You get how to go about it.
But you can't get full idea about it. You have idea about it.
But from what we've read now, it has shown that as far as we are
don't forget what you read. Go and ask a medical doctor. Don't say about what you read. It's not aligning with medical terms.
The thing is that what Papariano read, Papariano did not finish it. Papariano, what you read, you did not finish it. You read the part that you wanted to read. Papariano, go down, like continue reading and tell me how they said you can administer that. Just keep going.
Just before you carry on. Read what you have. I'm listening to this. Read what you have. Yeah,
I don't have anything. You said something like immunoglobulin, right?
Just before you carry on, just a quick one. So the dosage doesn't matter when it comes to hypertension.
What's in this one?
Yeah? The dosage only, the only work on dosages. You only work on dosage is when you're trying to basically determine how bad, how severe the wound is. Yeah.
What are you saying?
You don't need
What are you saying?
I'm saying that dosage is not based on hypertension. Dosage is not based on a medical condition.
Are you for real? Are you actually for real?
Be like I go jump out because these are not enter.
That's the fact. Go and check your book. Go and read again. Go back to school.
I don't. You see, you have come now. Titus, no tell me say make I go back school. Oh, you don't come. Which time you say go back school?
They even talk like say person won't know even go school.
It's you guys that it's you guys that causes now. You let him to say his own, and you guys
know what is he saying? Everybody is not daft. Everybody is not daft. You don't just come up and say something that is not right.
No, you can't lie to talk. And you
cannot compare me and you now. Papariano was saying that can be given. You give it IV.
You cannot compare me and you now. You accepted with Papariano because of what Papariano read out now. You have not even made it. You have not even tried to investigate on what Papariano is. He said, based on what Papariano is reading. Based on what Papariano is reading. Immediately that thing happened. Wait, let me finish now. Wait. Immediately that thing happened. And Mohbad died. I asked questions. Even when they told me they saw blood, I asked questions. Me, I don't talk because I want to. I ask questions. And I will ask questions from a reliable source.
Who is the reliable source that you ask?
Classic.
Not reading online.
When Papariano read it, it makes you I was like, what? He said it's not just ordinary Google, it's under medical stuff that he read it. And I said, wait now.
Just and I have your own.
Let me also
let me give you assignment. Just
wait, Sandra, wait, please. And I said something again.
I said these Wummi people they cry.
Also applicable to law.
Wummi is innocent. Who not go sit down for now house?
Google, and you want to read that they call something black book of law, that they would like you to go and read more details about it. And at the end of the day, we concluded that okay, well, if that is the case, like Sandra said, I will ask my younger sister that she's a nurse to make finding of this thing. Did I go on and argue about it? No.
This is what
I'm trying to say that whatever that I said about Wummi, it's what it is outside here. It's not because I added to it or I removed from it. I just have to keep quiet because I don't have details about these things.
But Justice, do you believe that?
Then we have concluded on that part now. Sandy, let's move on.
Okay.
We have concluded that you go and ask questions about it, no problem. So ask questions about your doctor.
Your doctor first of all laugh. Yes. Before I go answer you.
So ask questions about it. There are some things that we don't need to disgrace ourselves online.
We just know that it's not my feed, so you don't expect me to know it. But it is when it's not my feed and I'm arguing it. So that will sound so stupid. That was why I wasn't.
It's not my feed as well now, but I'm interested in Mohbad's case. So when I
shut up, you're not interested in Mohbad's case. You're not interested in Wummi. This guy is interested in Mohbad's case.
Look at it. I never take interest on that part. Anyway, because this is the reason why. Because from the beginning,
you want to hear Wummi badly now?
No. Classic, please. I was using what Wummi was saying, what they are saying, the corona inquest. Like I said, everything that I said, I didn't add to it, I didn't remove from it. Because that's what I said, like you always say, there is a karma for everything. And you can never see me that I've placed curse on somebody on this app. I don't curse. I say my things the way it is. You understand? So in this one, I will go to this one. I told you, I don't know about it. I'm going to ask. I don't want to argue further. You should respect that from my own side. I'm not arguing with you blindly because I don't know it.
It is well indeed.
What did I said that Wummi was crying because of DNA? Because
you've been actually quoting Wummi. But Wummi has said this thing, and you have not quoted this part. Why are you picking the ones you want to actually quote?
Wummi has said what?
Why are you trying to quote everything?
Wummi has said what?
Not the next now. Since you are quoting everything Wummi says, you understand? Yes. Why are you not quoting that part of the story in the CTC that the next
classic. No, it is where we get to. I can't just jump to something. We got to this bridge now. We'll talk about it. I can't just jump the fence. When we got to it, Wummi said it. Oh, Wummi said it was a nurse that injects Mohbad. And when he injects Mohbad, the nurse quickly went outside and go and get something. Before the nurse will come back, he already see Wummi pouring water on this boy. According to the reports, before the nurse came back, they already pouring water on this guy. They already drawn this water. This guy inside water. The nurse was shouting that why will you be pouring water upon this guy? Now why? It's in the CTC.
Good afternoon. Good evening, everybody. Good evening, Paparazzo.
Classy babe, was there a place that the nurse was asking that we're going for?
Just a very quick one on the hypertensive condition. Now, if you are hypertensive, that means you have a constricted arteries, or you have a kind of a blocking heart, basically. So when it comes to administration of intravenous fluid into your body, the dosage and the handling is very peculiar and different for people who are hypertensive. If that answers your question. Yeah?
Yeah, you're right, man. It's just so simple.
Because I saw the argument and I said, okay, let me jump up just to add my point.
Yeah.
I'm a patient, but I'm telling you from that perspective, okay? I'm not a medical person, but I'm a patient. So, and when it comes to somebody who's hypertensive, you need to be careful when it comes to putting things intravenously into their body.
Yeah.
Because that could cause the other way around, and the artery gets more constricted instead of relaxing, right?
Yeah.
It's something that affects the endothelial cells of the arteries.
Hey Sandra, classic. I had something, so I don't know how to treat it. Because me, I just add. You can say I'm acting now.
And, very quick one. I'm not a Wummi's fan.
Do you hear about
and I'm not Joe Bad's fan.
that? They said Wummi went to go and stole phone from Mama Mohbad's house. I just add. I'm not sure.
That's no mind.
I just want to answer something.
I just add that one. If you are just hearing, that will not be news again.
No, you know, classic. I had, I've not seen you people that know Wummi very well to testify that yes, no, I'm just hearing for people that are supporting Baba Mohbad. You understand? And I don't want to just take sides. So I want to hear whether it's truth or not. You understand?
Since you've been taking sides, why is this one different? Still, Kuku take all the sides.
No, Sandra. If you see what I'm saying, I'm cutting them. I'm not taking anybody's side.
Since you are just hearing, let me assume you are just hearing.
I'm not just hearing. I am.
Now, Wummi just the first of the news. It was Wummi just that said it initially.
That's what I'm saying. That I'm not
saying it. So that will not be news again.
That's what I say, classic. I say I'm not just hearing.
This one is more than 8 months. How many months people this the program?
Yes, so, I'm not just hearing. Like I said, I'm not hearing.
Any other
news? Wummi supporters to play for me. It doesn't really happen because
I don't want to play anything. The Wummi people, no people, not here. She be there, you don't people, you don't need to debunk anything. You judge, you know,
Hello, can you guys hear me?
We can hear you very well.
Sandy, are you there? Sandy, are you there?
Why did you drop? You drop somebody now, Abby? You want to?
No, I didn't drop anybody. It's network. No. Close waiting. We are just starting. I just finished it. I didn't have you guys time all this while. Wait, Lord,
I don't accept.
No. I want to correct something. Okay, the police are the one causing mistake. Two video was released about the nurse, about what the nurse gave to Mohbad. One said intramuscularly. When you give an injection through the arm, is that IM or IV? I want to know. That's why I was calling Sandra. Sandra, are you listening, Sandra? When you give an injection through the arm, that is intramuscular. Okay, that's through the muscles. Okay? somewhere around the forearms, as we can see here. All right, you can see my veins. Now I want to play the second video. The police did 2 videos, and listen carefully. That's what I was trying to play. The first one that they did, they said some other things. The second one, listen carefully, okay? Because now we are saying that the police are not just serious with this whole investigation. Now you will tell me between the one that I first played, they said he gave 3 injections. But this other one now, they're not talking about 3 injections. It's even going, oh, just listen. Before you begin to say the police have done the best job, you are satisfied whatever they did because they did not arrest Wummi. You are satisfied. You will tell me what is making you satisfied. We are going to debunk it. Papa, you know, 5 FM. I hear with you. You die for you, man.
Oh, for a job.
The suggestion that Mohbad from witnesses evidence was said to be tipsy, but attended the musical concert at Itíôn town.
Let's take it back.
At around 21:00 hours on the invitation of one Soberano to promote General Peter's image, which is marketed. Mohbad arrived in the venue of the event at about 19:00 hours in company of his wife, Mrs. Omowummi, and their 5-month-old. His childhood friend, Itíôn, and Mohbad's personal assistant, alias Larissa, all of whom were in the private jeep, which was hired by Mohbad for the event and driven by friends and sample. Others that accompany Mohbad in separate vehicles include Ayoba Spending, Adura Baby Shedra, who is the younger brother of Mohbad, and Jesse Sultan Ayoba, Mohbad's secret. Ademinto Fawaz Ademola Adewes, Mohbad's friend, and Olariwaju Idris Adedoja alias Oichi, his photographer. Other musical acts that performed along with Mohbad at the show included Satan, Shewuti, and DJ Fokati. At the end of this performance at about 23:00 hours, as he led to exit the venue with his entourage, he discovered that his vehicle had been blocked by other vehicles while some of his fans and area boys also moved in. Mohbad, who from witnesses' evidence was said to be tipsy and hyperactive, became infuriated, and as he attempted to come down to clear the road, Ibrahim, his friend, prevailed on him not to do so for his personal safety. This further infuriated Mohbad, and it eventually degenerated into a hot argument between the two of them and physical fights. In the course of an attempt by Mohbad to hit Ibrahim with a blow, Mohbad missed him and smashed his hand against the window of their private jeep, causing him an injury on his forearm, and he bled profusely. Eventually, the situation was brought under control, and the undivided for the lady residents of Mohbad, excluding Ibrahim. Upon arrival at home at about 02:00 hours of 11 September 2023, Mohbad refused to go to the hospital to treat his injury, despite persistent persuasion by his wife, spouse, and friends, including the private jeep driver whose vehicle was damaged. Later in the day, the injured hand, which was still bleeding on the second day, started getting swollen, causing Mohbad unbearable pains. It's the injury. He also position. Hand got swollen by the second day. So at this point, his friend Itíôn spending, who noticed the increasing pains, further insisted that he must go to the hospital for treatment. Mohbad still insisted and opted to call his personal nurse, identified as Nurse Wummi, who unfortunately was not available. At this point, Itíôn spending offered to call his own nurse to attend to Mohbad. That nurse turned out to be the auxiliary nurse, Miss Itíôn. His suggestion that Mohbad consented to. When Miss Itíôn was contacted at about 14:30 hours on Monday, 11 September 2023, she was unavailable but promised to call the following day, being Tuesday, 12 September 2023. Ahead of her arrival, she requested that a picture of the swollen hands from injury in the area, a video and snaps, and sent to her for assessment to guide on the medication to come along with. This was eventually done. At about 14:35 hours on 12 September 2023, Miss Itíôn eventually arrives armed with one bag of central injection, one vial paracetamol injection, tetanus toxoid injection, one vial cocaine medicine injection, 7 apples of IMD, diclofenac, tincture iodine, several needles and syringes. Miss Itíôn administered the tetanus toxoid on the arm of Mohbad and gave both the paracetamol and central injection intravenously. Immediately, the central zone injection was administered. Miss Itíôn confirmed.
All of you who are nurses here, Miss Itíôn administered the tetanus oxide on the arm of Mohbad, and he administered ceftriaxone and paracetamol intravenously. Now, Sandy, this is to you. According to this statement, is this a correct statement, Sandy? Does this violate the other statement? Does it contradict the other statement? Sandy, unmute your mic. Any contradiction?
Hello?
Hello,
Can you
any
hear me?
contradiction? Sure.
Yes, there's contradiction. Yeah.
So can we say there's contradiction in the police
The
report?
first one said IV,
Yes.
and this one
The
says
second one says IM.
on the arm.
Which is IM.
Yeah, give that.
So can we say the police is not serious with this investigation?
So which one comes first? Actually, Papariano. Which report comes first? Because remember, the first one was a preliminary report.
No. They're both are preliminary. They both were released the same day.
Both of them were released on the same
It was the
day.
same man who said so. Yes, the same man who said so. This don't forget, I'm reading from watching from YouTube. The same man, one is 29 minutes, the other one is 34 minutes. Okay? On one, look at how it happened. When you are writing your papers, okay? Like there's place whereby you will give abstract, all right? You will give introduction, all right? So in the introduction, you're going to briefly highlight like a paragraph that in the body you'll be discussing more in length, right? So the first one, it was just cut short. It was the same long video. Okay, the first one was where they were just like giving you an abstract, like a tips, what they're going to discuss. This one of 34 minutes is the one that carries more explanation. When they said that the nurse came about 3, whatever, he didn't take time. He didn't even explain what the nurse bring. But in this particular video, he was able to explain what the nurse brought. The nurse brought a packet of tetanus oxide, ceftriaxone, all of those things, and he talked about the fire and everything extensively. Yeah, but on the other side, the 29-minute one, it was just briefed. Okay, so can we say now that this man, this is a very big mistake on their side? Can we agree on that?
Yeah, because why if I mean it's confusing to be very honest. Because how would they say?
It's supposed to be the doctors and the police. Go on.
I wanted to say, or did the nurse give IV and also give IM? Because why would they say IV and also said IM? Because are they not reading from the testimony of the nurse?
The same police who say Mohbad bled profusely, are they just using words without even knowing what it means? Who wrote this report for the CP? And this is the CP of Lagos State. It's not promoted. It was even promoted for job well done. I just think the reason why we've been fighting, because this is another new discovery right now. For the first time, we are just finding this information.
To be very honest, I don't know. Unless I don't know, because.
Or should I play the previous one again? Should I play the previous one again?
No, the previous one was clear. It was clear.
No, let me just for those who know here. Let me quickly play. That one won't take time. Let me play the previous one again, so people can hear. So this is 29 minutes. 1 minute.
Free with 24/7 live support. Access all to trade.
Adverts.
She's the principal suspect. Where the principal suspect? Yes, in the eventual death of the singer. She's the principal suspect of the 1520 hours. So, Miss Faye side, paracetamol, and they have aided in establishing the sequence of events leading to the death of Mohbad, the identification of the suspects, and the roles each played. They have also aided in gaining a clearer
Talking about the briefing.
into the allegations of assaults and bullying leveled against Anari and Naira Marley. Suspects. 5 suspects have so far been identified, arrested, and detained, and interrogated on the alleged roles in the sequence of events that led to the death of this singer. The summary is as follows.
Now, from the summary, those of you who are watching on YouTube, watch from there's 2 videos of the police preliminary report. One is 29 minutes 10 seconds. Take it to 11 minutes 46 seconds, or take it to virtually 12 minutes. Okay, listen from there and listen to the statement, and then we're going to take it to the 34-minute video. And we'll show you the contradiction, which is so bad, which doesn't even give us any hint or any direction. In fact, it's too bad. It's bad.
Miss Faye Sayo, okay, is the auxiliary nurse who was contacted and invited by your barrister, aka Spending, a friend of Mohbad, on 11 September 2023. To treat the singer and the deceased residents in Lekki. She eventually came on Tuesday, 12 September 2023 and administered 3 different injections, which are believed to have occasioned the chain of reactions that directly resulted in the eventual death of the singer. She is the principal suspect in the death of Mohbad. She acknowledged that it was the injections that she administered on the deceased that triggered the reaction which eventually led to Mohbad's death. Other expert opinions and witnesses' statements corroborated her admittance. The action of administering doses of tetanus toxoid, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous on Mohbad at his residence, that's Mohbad's residence, on 12 September 2023 in May.
Did you guys notice something here? I think this was just simply negligence on the side of the man, and I think he should get away with it. What do you guys think, both of us? Did you guys notice something here? Yeah.
Yeah, like, I don't know, but this is strange to me. Like, I've never heard that 2 versions of the preliminary. We have always known 1 video.
No. You have been following this since December. It's always been.
Yeah. I don't know.
You know, like what I noticed here, which I'm gonna say, right? Okay. If you listen very well again, there seems to be no contradiction. All right. Listen very well. Let me just
please play it again. There's an also injected there. Play it again.
Yes, there seems to be no. There's just like a misuse of words. Let me take it back.
Other expert opinions and witnesses' statements corroborated her admittance. Her actions of administering doses of tetanus toxins, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous.
You see, when he called tetanus oxide, he didn't call intravenous. He only called intravenous when he mentioned ceftriaxone and paracetamol. Let me take it back in. Listen. That's what I'm saying. It's like I mean, just like carelessness here. Just listen.
She's a principal suspect in the death of Mohbad. She acknowledged that it was the injections that she administered on 86 that triggered the reaction which eventually led to Mohbad's death. Other expert opinions and witnesses' statements corroborated her admittance. Her actions of administering doses of tetanus toxins, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous on Mohbad at his residence, that's Mohbad's residence.
You see what happened? So now we can say there was no contradiction. It was IM. Yeah, he didn't mention.
Let me tell you what happened. No, let me talk. Papariano. Just like when you say Papariano, Jack, and Classy Babe. Yeah? So it is still in the same sentence. It's still IB.
No, it's not the same. It's not the same. Listen. Sandy, see what he did here. See what he did here. Let's do it like this. Let's say, listen, please.
Okay.
Let's say three of us ate. We ate the food, okay? So me, Papariano, Sandy, and Classmate, okay? So Papariano ate the food. Sandy missing ate the food with her bare hands. Oh no, Papariano ate the food. Sandy missing ate the food with a spoon.
Papariano, wait,
just wait, please. Papariano ate the food. Papariano ate the food. Sandy missing ate the food with a spoon. Classy Babe also ate the food with a spoon. Now the previous one, Papariano, we don't know whether he ate it with a spoon or not, whether bare hands. You cannot say the same statement.
But this statement is clear now.
What the police guy said, right? He administered both injection intravenously.
No. That's what he said.
That's what he said.
That's the conclusion.
Just wait, listen, please, listen. There's no boat.
If you use the medical stuff,
just wait now. If you hear the word boat, just stop me. If you hear the word boat, stop me.
Other expert opinions and witnesses' statements corroborated her admittance. Her actions of administering doses of tetanus toxins, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous on Mohbad at his residence.
Papariano,
if you're in hospital, listen, if you're in hospital and you had a drip in your hand, they would never give you injection on the body anymore. They put it through that drips.
Exactly.
That's what he's trying to say.
That's a good point. That's a very good point.
That's the way it goes.
Yeah.
There's no need
that's what she did.
to punish you. There's no need to punish you unless it's an emergency case.
Wait. So what did you just say again? Say what did you just again? Say it again.
Listen, if you are on hospital bed, right, and you already had a drip into your veins, that's intravenous, right? They prick your vein like you rightly said, mostly at the back of your palm, right? And they plaster it, and that veins, and there's a bottle hanging up on top of your head somewhere. And if they want to administer any medication at that point, they put through that drip. They pass it through the drip, and it goes to your vein directly. Yeah. That's what happens.
Okay, now
but what I think, if you ask me honest opinion,
no problem. Wait. I mean, just wait.
Wait, let me talk now, Papi.
No, just wait. I'm coming. Don't let him wait now. If somebody is saying a valid statement, it is either we agree or I've not agreed with him. Don't add to it. Just wait. Okay? Want to verify his statement, then come to your own statement. Or your own statement will take us from that place. Let's verify what I'm saying. If you are saying that once the first injection was given, okay, and there is a bag, I mean the bag containing the
that's the vein, that
solution, okay,
that's
the solution. So now, what we are saying here is that any other, solution any other injection whatever that want to be given will be added in the solution. Is that what you're saying?
Sometimes, listen, let me tell you exactly how it works. Sometimes it depends. If they want that thing to go through your vein, you see, they pierce your veins once. They won't do it twice, right? And the pipe goes in.
You're not getting my point.
Let me explain. You understand? Honestly, 1 minute. Let me explain that you understand. You see, that jig that goes into your hand always have like 2 or 3 entrance. You can use one. If I want to give you that injection directly into your vein, I'll open one and I'll put my injection there, but you won't feel any pain. It's the same pipeline that the water is going through.
I don't have a problem with that.
That's your vein.
I don't have a problem with that. See what I'm having a problem with it. Let's say, for example, okay, in a situation whereby 2 injections was to administer an instruction from the doctor, okay? That 2 injections be administered intravenously and 1 intramuscularly, okay? If you were the nurse and I am a doctor, I pass you this instruction, how are you going to administer it?
No, the doctor says, I said it all. I want intramuscular and I want intravenous. It's 2 different things.
So would you go put everything in the same solution? Because
no, why should you? Why?
So now what we are saying is this. Let's say even though there was a bag, okay, and 2 injection was supposed to go through the venous, okay, of the patient. Now, because one of them has to go through the muscles, okay, you are not going to put it there because it was not meant to go through the veins. You're going to put
for example, in the vaginal injection, for example, in the vaginal injection, you don't put it in the vein. You put it in your bone. You put it in the bone, muscle. Yeah.
Exactly.
Yeah.
So now, this man is making it clear. This man said that tetanus oxide was given. Okay, he didn't mention intramuscularly or intravenously.
Oh my God! He said was administered through the vein.
Just wait, let me play it again. Listen, just listen.
Oh, but Friday, you're playing devil's advocate. I'm sure you heard it.
I'm not.
That triggers a reaction which eventually led to Mohbad's death. Other expert opinions and witnesses' statements corroborated her methods. Her actions of administering doses of tetanus toxoid, paracetamol, intravenous, and central zone injection, which was also administered intravenous on Mohbad.
Stop there. Okay, he said.
Which was also administered intravenous. I mean, both.
That is this is the first statement.
Paparano, what he said there, it was addressing all those injections separately. It wasn't joining them together. It was addressing them separately.
The first one, the second and the third was intravenous. The first one, no specification. Come on, what
No,
are you saying?
no. You can't.
Adebini said that the tetanus oxide was administered, the ceftriaxone was administered, paracetamol was administered intravenously.
No, Papa Riano. Let's see, why Papa Riano hang?
Tap.
Papa Riano.
Let
me say something. Papa, you know this is what he's saying. He said tetanus toxoid. Let me put comma. He said another thing. He said ceftriaxone second, comma.
He didn't say second. Ceftriaxone.
No, I don't think he said second. Like,
why did he mention intravenously on ceftriaxone?
No, now he's just he just collecting the whole item together.
No, he was collecting everything. He will put in bracket and then mention intravenous once.
Okay, Papa, after he said tetanus toxoid, did he talk about IM or IV after tetanus toxoid? He didn't now. You're saying,
Yeah, but after ceftriaxone, he mentioned intravenous. After paracetamol, he mentioned intravenous again.
No. He
That's
just
That's true.
Now,
you guys are not getting listen.
No, that's true, Papa. Yeah, you mentioned intravenous twice.
Other
Listen.
expert opinions and witnesses' statements corroborated her methods. Her action of administering doses of tetanus toxoid, paracetamol, intravenous, and ceftriaxone injection, which was also administered intravenous on Mohbad.
Okay, pause. Okay, Papa Riano, with this thing he said, how will you say they administered the tetanus toxoid from you? Answer me now.
Yeah, that's also, it's not specified here whether it's
but you cannot
IM or
also
IV.
say it was given IM. You cannot
Yeah,
say that.
that's something like, I caught him the slack there. Yeah, he didn't say it was given IM or IV. Okay, but now in the body, don't forget this was just the abstract. In the body of the video, let's play the other one, which is specified. From the other one, if you play the boat, now listen to the other one, which is the body. Listen from you.
The suggestion that Mohbad consented to. When Ms. Fisayo was contacted at about 14:30 hours on Monday, 11 September 2023, she was unavailable but promised to call me for a day, being Tuesday, 12 September 2023. Ahead of my arrival, she requested that a picture of the swollen hand from injury in the area, a video that snapped and sent to her for assessment to guide on the medication to come along with. This was eventually done. At about 14:35 hours on 12 September 2023, Ms. Fisayo eventually arrived and it came out of ceftriaxone injection, 1 vial paracetamol injection, tetanus toxoid injection, 1 vial propane penicillin injection, 7 apples of IM diclofenac, top iodine, 7 needles and syringes.
Nice.
Wait, let's take it back again. Wait now, you guys should come in, please. Listen to something.
Ms. Fisayo eventually arrives and is born out of ceftriaxone injection, 1 vial paracetamol injection, tetanus toxoid injection, 1 vial propane penicillin injection, 7 apples of IM diclofenac, tincture iodine, 7 needles and syringes. Ms. Fisayo administered the tetanus toxoid on the arm of Mohbad and gave both the paracetamol and ceftriaxone injection intravenously. Immediately, the ceftriaxone.
He said both, not the other side. The both. So it means there was only 2 recorded situations where injections were given intravenously. On when it was given arm. Now he has corroborated, he has helped himself. He omitted arm before. So it's still along the line. We cannot call it contradiction. We'll just call it omission.
Yeah. That was why he forgot.
Sandra, do you agree to this? Sandra, do you agree to this, Sandra? Because me, I like clarity. Sandra.
No, this is very clear.
I'm confounded, to be very honest.
It's very clear what the policeman said.
Wait now, don't speak for her now. I beg, wait now. Sandra, go on. I like clear people doubt. Sandra, what do you say?
Papa,
I want to hear from you.
I don't know, this is confusing, but yeah, I mean,
wait.
Speak
only you.
Wait, man. You started though. Wait, calm down. What you said, like, he's trying to say that she gave.
Like omission, not contradiction, but omission.
I mean, I'm still trying to process this. It doesn't really.
You know, in the first one, he said tetanus oxide, paracetamol intravenous, ceftriaxone intravenous. Now in this one, he said tetanus oxide was given in the arm, paracetamol intravenous. No, both paracetamol and ceftriaxone was given intravenous. So it means he just omitted arm in the other one.
Oh wow.
And where did the diclofenac go?
There's nothing too bad. What is too hard there to okay, class will coming. Come here, I like to clear them because
he already made the guy a zombie. And you know, out of
Richie, wait. I just want to tell you about that for class people now.
Antibiotics was given through the vein.
Wait. Let's work. I know that is antibiotic. Let's work with the three mentioned name. Ceftriaxone, which is antibiotic, I know ceftriaxone, paracetamol, and tetanus oxide. Okay, now go on.
I've said what I have. I said antibiotics were given through the vein and
call it ceftriaxone. Call it ceftriaxone. Ceftriaxone. Nobody mentioned antibiotics here. Ceftriaxone and paracetamol was given through the vein, and the
even if they did not mention but we all know it is antibiotics. So I don't even need to call ceftriaxone.
Ceftriaxone is an antibiotics.
I don't even need to
call it ceftriaxone. This is not an argument now. Just call it the name that they call it, ceftriaxone.
Ceftriaxone, antibiotics. I feel comfortable calling it antibiotics. So it was given through the IV.
There are so many antibiotics now. Oh my God.
Just for this.
The one that administered to.
Oh my goodness.
Mohbad or through the IV, and we don't know the dosage. We don't know how it was mixed. So. Alone. The best thing we can do for Mohbad
It's not just the meat. If somebody is having high blood pressure, you cannot just be bombarding them with those kind of medication.
Hold on.
That is
what I am saying now.
Babaka asked for DNA. Later on, Baba asked for DNA. You collect DNA.
Sandra has made it clear. Sandra is just being faithful.
No, just say this is right now. This is right. I don't know. You guys will argue with Baba can ask for DNA. Baba can for DNA. I mean, at the end of the day, we go up, go down, DNA is still corrupted.
I have always said, I said Baba doesn't have the right to ask for a DNA. That is what I have been saying. It doesn't have the right to ask for a DNA.
If Baba doesn't have the right to request for DNA, when Wummi filed a preliminary objection against Mohbad application to be struck out of the court, and the court did not, what does that show?
What application was that?
A preliminary objection, which is that is before Wummi will sit for this case at all, the court must first review on what right, must question about right for requesting her to come and respond to this case, to verify his right, okay, for bringing this case to the court. If he doesn't have the right, Wummi will not even come, they should kick struck about Mohbad application out of the court, but that wasn't struck.
He doesn't have the right, Papariano. Wummi is doing this thing willingly, and probably because he wants the husband to be buried.
I need to speak to your lawyer. Which lawyer is lying to you guys? Bring TikTok lawyer here, or Pythagoras. Bring those guys. That's why I need them. Again, one TikTok lawyer that is always lying to Wummi people. I I don't know where that guy is. The guy will be using fake account to watch me here. He's running. You know, go see us captain again.
It is not about a Ticos lawyer or not.
I am really very sure. It is very simple, okay? Now, it has been in a judicial precedence. The Sahara, Wummi Sahara Newsroom, I don't even go to my own back punch again. Now I want to work with Wummi Sahara News. They made it clear that the court has adopted the settlement that was made by the two parties out of the court as a judgment to this case. The implication of that means any grandfather in Nigeria in future can come and say, just as the case of Joseph Aloba versus Wummi Aloba, okay, and the grandfather, on behalf of his son, requested for DNA and was granted. And the judgment was hold. Don't forget, the court is not going to be used as a tool for anybody. Okay? The judgment, the court is only going to sit on a case where they have jurisdiction. So the court blatantly have jurisdiction, and Joseph Aloba have the local standing. And that is finished.
Sorry.
I need your lawyers. I need to speak to your lawyers. Your lawyers are always hiding.
Listen.
Listen,
it's not about lawyer. You are being generic when you said in future. It's case by case, right?
Do you know what they call judicial precedence? Rachel, please.
I understand what you're saying. Listen, I understand what you're saying.
What does judicial precedence mean?
You are saying that now this is being enacted as a law. Judicial precedence. I understand what you're saying. But
it's been established. It's been established.
There's nothing established in this thing now. Papariano, what are you saying? Wummi is doing this thing willingly. It's not that it is the court that established.
It's not willingly anymore. Because at the end of the day, the court adopted it as a judgment. That's the implication. That's the danger.
If the court sits down for DNA, Papariano, stop this. Stop manipulating people.
Listen, the way I looked at it, maybe from my own perspective, is they both settled. It was settled in family court. The same thing happens in Western world. You can settle things in the family court. That means they reach a compromising agreement between themselves.
Exactly. What is Papariano saying?
Richard, do you know what it means for a court to adopt any adopted judgment by the court? Do you know what that means?
The court may decide, like what you said, but it doesn't have to be generic in future. You still have to come with your case.
Okay, let's see. Wait. To
attain that level
Rachel, please wait. Okay. How does judicial precedence work in court? Let's say, for example, there's a future case, okay, and a similar case has been judged in the past, and there is a result. Do you think it can be inferred to?
It can be referred to any time. It doesn't mean it doesn't mean. So
most laws, right? Let me say something, right? Yeah. Most cases, there are some cases are new. Okay, you don't even have a law for it. What the judge is going to look into, one is going to apply his legal knowledge or any previously past judgments. This is one thing that judges look in judging any case. First, either the law or the previous past judgment. So in this case of Joseph Aloba versus Wummi, it's been established that a grandfather brought a such motion like that to the court, and the court did not stroke it out. The court gave hearing to it, and the court adopted the settlement.
Listen, 4 minutes, please. I'm not in support of Wummi underline, but I'm just about this particular law, right? You actually answered yourself there. It's not generic. I'm still going back to what I said.
What do you mean it's not generic? What do you mean by that?
What I'm saying is, just because you make a reference to Joseph Aloba and Wummi's case in future, doesn't mean automatically a grandfather will be granted the right. You need to come with your audience.
No. That's not what
Joseph Aloba was not granted.
Wait. Let's do this. Listen. Now, this is the first time history of this country where a grandfather, in fact, when we are having this kind of case, it's always new historically. It's a new case. Okay. We don't have a case before in Nigeria where a grandfather requested for DNA. It has always been between two disputed fathers. Okay, two people claiming to be the father.
When did the DNA actually started?
Exactly. So, and those ones we have precedents, we have the past. Okay. So for the first time, people were thinking, one, this man will not survive in court. The court will throw out the case. They will throw out the case out of court. Okay, that was the initial expectation by some people. All right. Now that didn't work out. Okay, that is now further established. That will encourage any other father in the future that feels like their grandchild's DNA needs to be proven. Okay, that will encourage them, and because this was done in the past, it will show that it's a legal demand. You understand?
A pathway has been created. It's not automatic.
Thank you very much. You see, I want people to get something. Okay, when we say there's judicial, I heard from Wummi lawyer was saying that the reason why Wummi went to settle is because Wummi don't want the case to be a judicial precedence. Now my question to you: was this adopted judgment? Is any judgment passed by the court a judicial precedence or not?
You see, there's two levels of court, right? It's not magistrate court; it's a family court.
Oh my goodness!
Yes or no? Answer my question.
I mean, the highest court so far that has jurisdiction in this case is the magistrate court.
It was in family court. Family section.
Family court is not magistrate. The magistrate, they manage family now. What are you saying now? Who they manage family court, not magistrate?
I know.
It's the job of the magistrate now.
No, Papa, no, soft pedal. I understand what you're saying. The whole body of the court is magistrate court. I'm not arguing with that, right? But the way the case have been handled, you and I will sit opposite each other. No argument, nothing. We came there for an agreement basis, right? And then we signed a dotted paper. This is an agreement. Eyes to the right, yes. Eyes to the left, yes. Bingo, sealed, right? And at the end of the day, which is where you come into, that particular seal that's been signed, right? We get posted to the magistrate, and he or she will sign it. I don't know, maybe next month, 2 months, 4 months down the line. Say, okay, yes. Oh, are you guys happy with that? Okay, that's fine. Bingo. But for the magistrate, him or herself, presiding over the judgment, no. It's most of this point.
You are okay. When we say the magistrate adopted their settlement,
getting the point.
Wait now, you just have fight. I mean, you wait. Don't let me engage him. Please. No, come. You don't have this knowledge. Please just wait. We're not fighting here. We're not dragging. Let me engage him.
No, there's nothing like you don't have the knowledge here. You are just arguing things that are not arguable. You said they sat down to discuss.
I don't want to engage you. Wait. I don't want to engage you. Wait, please wait. Let me engage him. I'm coming to you. Let me be done with him. I'm coming to you. Just wait. Rachel, what do you understand by the magistrate court adopting a settlement outside the court? What do you understand by that? Adopting as her own judgments. What do you understand by that?
Outside the court. Outside the court means, listen, it's still being supervised by the court. Right? That means it wasn't presided over by a magistrate. That's exactly what I'm telling you. Do you know how many divorce?
Wait. So are you saying that it is not a court judgment? Is that what you're saying? Because it was decided outside the court.
No, it's a court judgment, of course. Like I told you.
On what ground? Listen, wait. On what ground? Wait. On what ground is it a court judgment? Explain.
Because it's under the canopy of the magistrate court.
Okay, so if it is under the canopy of the magistrate,
coming to the family court. Listen, maybe let me answer your question quickly. Coming to the family court, right? It's still under the jurisdiction of the magistrate court. We're on a soft pedal level. Nobody is in the dog. Nobody is talking about things like that. It's both parties came into an agreement, and they want this agreement to be sealed, right, under the court supervision. And that's it. It's a different ball game. So if you want to make reference to that in the future, it's not automatic. Yes, you can. I mean, sorry to say this, any household could apply for a DNA, right? It's whether you be granted or not. That's the case. And it's in Joe and Wummi's case, they both agree. They reach a compromise. And then it gets sealed up.
Do you know what is regarded as a consent judgment?
Yeah, we're still talking about the same thing.
Yeah, what is a consent judgment by a magistrate?
Consented judgment is split into 3 or 4 different categories. Depend. If you're doing a criminal case, it's a different ballgame. But if you're doing family
we're in a civil case. We're in a civil case.
Civil case. Thank you. A civil case, a family case like divorce or child protection or child custody, things like that, right? If both family, husband and wife agreed, right, or papa and daughter, or papa and son, whatever, agreed, okay, you know what, we're keeping it low. It's a family affair. And it's still
what is a consented judgment? Just go straight. What's a consented?
That's what I'm saying. That's a consented, because already for you guys reached the compromise, is consented. That's what I'm saying to you. We don't argue for that.
Can we say that the court has approved their settlement as a judgment which pleased the court?
Exactly. But it will be boldly written, listen, it will be boldly written that both parties, listen to this carefully, both parties agreed on the so bingo on so date, sealed. It's not that high. It's different. It's different from
legal,
high.
It was legal. Was such agreement, was such settlement legal before the court?
The statement is very crucial here. It's different from high. Magistrate do this. That he was sitting or she was sitting over it, and this is my judgment. No, both parties agreed on the line. It's very important, extremely important, and that's a family situation.
So what are you saying? You are saying that the court did not give a consent to that settlement?
Oh no, why are you twisting my word? It was presided over.
No, I know why I'm saying this. I'm saying this right because you are trying to make it look like because it was a settlement that was done outside the court, and the court later adopted it as a judgment of that case that was filed before the court. You are trying to underestimate right now. You're underestimating the process, saying that because the court only.
I'm not.
Okay, I want to ask you a question. On what ground did the judge consented to an agreement made by 2 parties outside the court?
Because it's being seen as a family issues.
Wait. Because the court has jurisdiction over the case, right? The case was legal before the court, right? It was brought before them, right?
Okay, let me just give you a very quick snap of example.
All right.
You and I were married, right?
No, don't use that, please. I don't do those things. Don't even go there.
Okay, listen.
No, don't use a man. I mean, I don't do those kind of stuff. Use a woman. Please.
No, okay.
I say you are
Okay, listen. Me and Juicy or Golden Seal were married, right? I can be polygamist. I'm married to 2 of them, right? And maybe 3 months down the line, and Juicy give me 2 fingers. I want that, right? And this is me having AZ of 8V kind of properties or whatever, right? That's more attractive to both women. And I said, listen, girls, don't kill me. You can be out, but remember, I had this prenuptial agreement that you can only take this. Everything that I had before I get married is mine. But anything I had after marriage, we can split, right? And all of a sudden, he said, no, everything you have from the beginning, we're going to split. That becomes a court. We're going to settle in a court, which a magistrate will prescribe over. We'll read each other's statement, we'll get a lawyer, she has her own lawyer, right? But at the moment that she has her own lawyer, I have my own lawyer, the 2 lawyers will be talking together. Are you getting my point? And then all of a sudden, we reach a compromise. They said, okay, you know what? Okay, just give me half. I'm okay, I'm fine. Or I said, you know what? You can take some of it. I'm fine. Yeah, what happened? That statement is not going to be a verbal statement. It's going to be documented and sealed in the family court. And what's going to happen is, okay, yes, hey, you both agree, okay, the highest to the here agree, the highest to the right agree, okay, I'm giving you 20, 30% or whatever, right? And we both signed, even smiling at each other, right? We agreed. And what happened? The family court, right, will now say this has to be sealed by the magistrate. But the magistrate was not the one that prescribed the judgment. It's an agreement judgment where it has to be sealed just for future references. That justice doesn't come back to me. Hey, I didn't say that, or I didn't go back. No, that's not what I said.
No, let's look at it this way. So let's say Justice and you, as you said in your example, have such agreement of how the percentage should go between both of you, okay? So, and the court sealed it, okay? The court consented to it and sealed it. Let's say in the future, okay, maybe after some months.
Maybe you used the word the court consented. We consented, the court sealed it.
No, it's called consented judgment. That's how it's called. That's the legal. Name for it.
The court is happy with that decision.
Yes.
Okay.
So now let's say Justice, who had gone through that agreement with you, all right. Yes, with the court consented. Now let's say after some weeks or some days or some months, Justice was not pleased. Can Justice appeal that case?
You have a given deadline in any ramification. When you divorce, they give you almost like 6 months, a year before they issue your final decree.
No, we're not talking about marriage right now. No,
it's the same thing. I'm giving you an example.
We are saying, okay, let's say for example, let's bring it back to the
it's a divorce. Listen, Papa, it's a divorce settlement.
Wait, now,
oh my God.
No, we're gonna go far away. Okay, let's bring it back to the DNA case. Let's say now, okay, Baba Mohbad and Wummi, they have agreed on the procedure for the DNA to be done. Okay, and now the court has prevailed over their agreement. All right. Now, let's say the result came out and Baba Mohbad is not placed. Okay, can Baba Mohbad, can he open another dispute case or appeal?
Of course.
How does that happen? Go on.
It happens in many ways. You can say this: I suspected a foul play. You can see there's so many pathways to argue. You can always appeal.
Don't forget. It was not a judgment by the court. The court never presided over it. So, are you saying he was not ready to go into that agreement? What was wrong in the agreement?
You're talking about two things now. Just because I went into an agreement doesn't mean you should give me a fake result, right?
No, that's not what I'm saying.
Okay. So what you're talking about? You can always protest. You can always appeal.
Let's look at it this way. Let's say by procedure, it was said that the judge is going to provide a center. Okay, that is the magistrate. Is going to provide a center where this DNA is going to be conducted. Okay, just wait. This person is just causing problem here. She's so thin. She's still fighting. They want to be at all costs. Okay, I understand, but don't worry, I'm here for you guys. So now, let us say that Wummi and Mohbad had already settled. They have given their terms on the reason, on the conditions, how the DNA is going to be done. Don't forget, in the conditions, the court is going to go do it. Okay? So now let's say the court went to do it and the court brought its results. All right? And Mohbad is not pleased. Now, the conditions says that the court will do it. Now, if Mohbad appeal, his appeal is going to make a higher court go do the DNA again, right? It's always a court that will do the DNA. Always a court. Yeah. Because that was the agreement.
Yeah.
Okay. The agreement is not Baba Mohbad will go and do his own, or Wummi will go and do his own. It is the court that must do it.
Understand.
So the magistrate court cannot do it.
Yeah.
Exactly. So that's what I'm saying. That the agreement that was that the agreement that they struck, okay, is binding. The both party must respect the agreement. Okay. But now, what are the things that happened that led them into the agreement? And that is where I'm talking about judicial precedence. Where
I understand.
An application was filed before a court. Okay, with an affidavit, and the court, the court obtained it even after a preliminary objection was filed to kick that application out. Yes, the application went through. So is that a judicial precedence or not? Generically, I mean, generic speaking, not just on one case.
Yeah, I'm still going back to you. You can call it.
No, I mean, I'm just trying to confirm this first. Can we say through that, for after the preliminary objection, okay, after the preliminary objection, and yet the application stand, can we now say that by judicial precedence, a grandfather has the right to request for the DNA of the grandchild?
Okay, let me take you back. I'll say it again and again 1,000 times. Any asshole, sorry for my words, who applied for a DNA. As I'm sitting here, I can say to them,
that is not what I'm asking you. You're not answering my question. Answer my question. Does Mohbad have the right to apply to demand for
right? You as you're sitting down here,
that is not my question. No, that is not my question. Don't say me. Does Mohbad has the right?
Yes. Exactly.
So wait,
yes, right.
Just wait. I'm trying to clear something. Just please wait. Don't use too much grammar. Tolani, does Mohbad have right to demand for the DNA of baby Liam?
Okay, so that's where you going?
Yeah, because they don't know the difference between demanding, granting. They don't know those things. They don't understand. But then I want them to understand that just because somebody demanding for something, it doesn't necessarily mean it's granted. But they are mixing it up. He doesn't have the right to demand. He doesn't have the right to ask. He cannot ask. The court won't allow that.
No. You can always ask.
But they don't know. That's why you have to lecture them. I need someone to be going to their platform to lecture them, because they think they say, the man does not have the local standing. The man doesn't have the local standing. That is where they are the one that bring this local standing.
No, you can always
defend the public interest. At all time, we have always been doing that.
You can always ask for that. That's not an issue. Whether you will get is a different story. And they feel like you said.
Now, can we say there was a victim? Can we say there was a victim?
If this DNA, if the result doesn't favor either of them could appeal. That's the way the country is built. That's the way the constitution is built. Look at what Tunde happens. Appeal upon appeal.
Don't go too far. Okay. Now we have a consent judgment. Okay, that was made by the magistrate here, which was a settlement that was made by two parties, and the magistrate adopted it. You see, magistrate adopting their settlement as a judgment that placed the court. Don't forget, the court is not biased, right? Is the court biased?
Sorry, I missed one point. You got frozen. Can you repeat that?
I said the magistrate of the magistrate court of Itíôn adopted the settlement of the both parties. Okay?
Adopted.
Yes. It was because it was in line with the conditions of the court. Right?
You mentioned word precedent.
Yes.
Right? And this precedent came from the two parties being consented. That's a consentment between both parties, right? And the court said, yeah, are you guys happy? Yes, I'm happy. And sometimes all these things are done by the court clerk. And document will pass over to the magistrate to sign and send it to them individually. There's no argument. They didn't come to the court to argue. They came to the court, right? Just for the court's permission to say, based on what we agreed, the one is sealed. That's the reason for being in court.
But that can never be used on another case. It can never be used on another case.
Oh my goodness, yeah, but where people letting jab, people let nothing jab. Oh yeah, on mute, let's engage. On mute, let's engage. Okay. You see, even Top Movie was here and he agreed.
Let me tell you something.
He was here, we have agreed, we have moved forward.
Are you listening? I want to go. Let me tell you something about Child Act law. Okay? You, as if you are in a marriage and you have a child, while the guy is alive, accepted the child, it is what it is. Nobody has the right. Listen, let me finish. I don't want to argue because your people will come and start yelling.
They will not. Yeah, but let me turn your camera on. Let me turn your camera on. 1 minute.
Camera to me. I don't want your.
Let me on it.
No, I don't want your camera. I don't want camera. I want to tell you. If you listen to me. Let me tell you. Nobody, grandfather, grandmother, anything does not have that right. You can petition the court, but they will never grant it. That is the act. It works between, listen, it works for 51 tiwa, ofin. Now, Mohbad, what happened? Let me finish. Let me section in Nigeria. Most of how this thing works all over the world.
No, it's all over the world. Saudi Arabia.
In Saudi Arabia, go and read the Child Act law. That is on unless there is any sorry, so much jepe. What we are after Mohbad coup. Now the father now says, oh, me believe when me believe then, and I want to make sure so that I can be a part of that child's life. The court will agree just because of that. You understand? But while the father is alive, Baba Mohbad, the question they will ask him first is, why are you looking for a DNA?
No.
Since when you started this one?
Mo ti ṣàlàyé ẹ̀ fún ẹ, ìwọ máa wá sọ nǹkan tó fẹ́ mo mọ̀ ẹ́, Paparian ló máa yí bẹ́ẹ̀ tó yí tírélà ni, I know you.
No. Èmi mo fẹ́ kíkíní kò yé gbogbo nítorí tí ọ̀la wa àwọn ọmọ tá a bí sẹ́yìn agbọ́dọ̀ máa sọ.
Àwọn tó wà lọ́dọ̀ Jòsí ò fẹ́ gbóòtọ́ ọ̀rọ̀ period. So má wulẹ̀ sọ pé ó fẹ́ kó yé wọn kò lè yé wọn tó tó ọ̀rọ̀ bá wà lójú wọn báyìí wọ́n máa dín ní.
Wọ́n ti win, àwọn ló win, àwọn win. Báwo ló ṣe ní ṣe ní wọn?
So jákèmí máa bá tèmi lọ mò ń ṣiṣẹ́ lọ́wọ́.
What you fẹ́ come to career before you dey worry you suppose everybody go do.
Má fata ni mọ́ra ni I love you but tó bá ṣe nonsense pẹ̀lú Wummi èmi máa gbó ẹ. That's what I will do.
Ìyá àgbà ṣé ẹ mọ̀ kí mo mọ̀ yín ṣá?
Èmi náà mọ̀ ẹ́ àjọ mọ́ra wa ni. Torí pé iris ò sí bí mo ṣe gòkè torí yòó ń gbọ́ràn yìí tí ẹ̀ tí ó ti ní scores torí ẹ̀ mo ṣe gòkè.
Báwo ni obìnrin lẹ́wà yẹn ṣe báwo ló ṣe ṣẹ̀yìn obìnrin lẹ́wà yẹn tó lẹ́wà tó kú báyìí tó kú wà lọ́wọ́ rẹ̀.
Lẹ́wà tí wọ́n sọ fún ẹ pé mò ń dófòrò ni tó sọ pé ó lẹ́wà tí bá lẹ́wà òun ló mọ̀ bó dẹ̀ lẹ́wà òun ló mọ̀.
Máa tán kámẹ́rà yẹn sí máa tán ṣé kí n tán kámẹ́rà yẹn máa tán mo ti tán kámẹ́rà yẹn mo ti tán ok ó yá.
Ó ti sá lọ.
Ó sá mọ́ mi lọ́wọ́ ṣá. Ó sá mọ́ mi lọ́wọ́.
Paparano, Nanida, you
Ó sá mọ́ mi lọ́wọ́. Ó sá lọ.
I got your point anyway.
Ọjọ́ mi Yeah, so Richie, let's come back to you. At least you are trying. You are trying. Now, Richie, look at what we are saying here. A preliminary objection was filed by Wummi Cynthia Adebanjo against the motion filed by the head of the legal team of Joseph Oluwabamiwo Aloba Odumosu, Monisola Odumosu. Right. Is that right? So it was filed, and the court did not listen to Wummi's preliminary objection. So by judicial precedence, can we now say that the stage 1 was crossed? You know, like me right now, Twitching, I cannot demand, if I demand a DNA test conducted on your own kids, okay, on baseless reason. One, when the court review your affidavit, okay, which carries your sworn statement, if the court find it an embarrassment to that baby and not even in line with some certain conditions or statutory laws, you know, the court can strike that application out of the court. Do you know so? Not all applications go through the court. Do you know so?
Can you repeat that again? Sorry.
I saying that, let's say I, Papariano, okay, I just feel like requesting for the DNA test of your own child. I'm not related to you. I don't know your wife, I do whatever, but I just feel like, okay,
Please,
I don't believe that this child belongs to Richie. Okay, yeah. I've been seeing them around. The child doesn't look like him. I want the court to verify this. Okay, just because I made the application and I'm a Nigerian and I filed that motion before the court, okay, that doesn't mean it's going to go through. If the court look at the conditions, okay, why I'm asking for the DNA of your baby to be done, that case will not fly through. Do you believe so? Do you know so? It will be struck out of the window.
Yeah, but it doesn't mean you can apply. That's what I do. That's what I want.
We're not talking about apply now. We are talking about like asking and it going through.
Yeah, granted.
Like I mean,
for court, like I said,
we don't know what is granted, but I mean,
it's granted. No, granted means
granting the demand. Exactly, granting the demand.
Yeah, exactly.
Does not mean passing the order yet.
No, it's granted your request, basically, right?
Yes. And so Baba's request was granted. The Baba request was granted.
Exactly what I'm saying to you.
So right? Why were people saying? So what we are saying is not all person who file application to the court is granted. True or false?
No, not all. Never.
So for this one to be granted, can we say it's a victory first in the history of this country?
Can I? To be honest with you, I don't know the nitty-gritty of the event. I have to be honest. So because I don't know whether it's because the court granted it or because the both parties come to an agreement. I don't know.
No. From what I heard, is the nitty-gritty now. The fact was that the both parties were in disagreement. Okay, one always wanted the court. The court judgment, which is the court order, which is what Wummi wanted. Wummi always wanted that. All right, and Mohbad believed that his demands are honest and his demands are right. As in the family settings, he believes that he has that right. And looking at the law,
for me, I believe he has right in this kind of situation.
Exactly. But why people say they doesn't have the right? I mean, they are just losers.
No. The reason why, right? That's a big case on the ground, which he himself, he believes, that's his own opinion, and the majority of us believe that maybe this DNA case, right, is associating to the demise of his son, right? On the other hand, right, selfishly, it could be towards the estate of Mohbad. It's two things, right? So,
and it could also be maybe probably adopting the child as well and having custody. Having custody on the child. No, not adopting. Having custody. If I want to have custody on the baby, I don't believe it's my baby. It's my grandchild. I can't just have custody on that side.
Baba will never have custody unless Wummi goes to jail. Baba can share custody.
No, that's what I'm saying. Share custody now. I'm talking about
to have access to his grandson.
When I say custody, I'm talking about a shared custody. I mean, you cannot have full access on. I mean, even Wummi cannot. It's going to be shared custody. That child belongs to the family. If Wummi is eliminated completely as free person, right? Believe it or not, it's Wummi that has every right over the son. Are you saying that Baba cannot have a shared custody? Baba could have access, but not necessarily share custody. No. Are you now saying that the grandfather of a child cannot have a shared custody in the absence of the father, even when the mother is alive? You can, but at the same time, I'm still telling you, right? When it comes to based on your own opinion, based on your own opinion on legal. Papa, I'm not going to tell you about my own story, but listen, I'm telling you the truth, right? I don't want your story. As I say, based on your own opinion, you're talking about the legal status. I'm talking about the legal. I don't know about Nigeria, right? Over here, right? The legal aspect is the woman that caused the fraud, right? It's a woman that caused the things. And if it's husband and wife, yes, there could be a joint custody. But for grandparents, I don't think so. Okay, where you are, maybe it doesn't exist, but here in Lagos State, a grandparent can have a shared custody on their grandchild. That's how it is in Lagos State law. Okay. I can read it out for you if you want. I have done it for countless of time. If you want, I can just let me pull it out for educational purposes. I'm saying this thing now. That's because I've done it over and over. One minute, let me just quickly browse it. No. Papa, no. Let me tell you this, right? I like coming to your platform just because of your intelligence in terms of all this legal stuff. Okay, I don't work by my personal. Don't go by personality. Let's deal with the case. I'm just telling you. So I'm not going to. I can argue with you up to a point, but I will never argue blindly what I don't know. Yeah, no, blind argument. I don't like to go by blind argument because it's gonna kill the dream. Okay, instead of you helping people, you're putting them in darkness, misleading them. That is not a good thing. Yeah, okay, that is what distances me from Mohbad followers of Baba fans. That's sometimes you see me, I'm calling Mohbad with very harsh words and hard names. Okay, I don't look very. Does Mohbad know how I survive? It doesn't know. I'm just a man on my own who feel like to help Mohbad in my own capacity. Want to know. And I'm not going to let anybody. Listen. Let me bust your bubble. Like their followers. Let me bust your bubble. Won't be Danny. Look at me. Look at him. Let me bust your bubble. He wouldn't mind running. He wouldn't mind running under the bus to make his million. How about that? But that's not gonna work. Not someone like me. I shame you looking at you. So that is basically how we want the best for Mohbad. That's what we care. Exactly. But when you look at the whole situation of event that's happening right now, I believe that there's a lot of dealings that's happening in the background, which the public are not aware of. Even the Joe show. Let's come back to the DNA. We have not cleared that aspect of things. Okay, to the DNA. Now, what you are saying is that you are saying that. So let me clarify this question. Somebody was saying the situation right is different from having a full custody or shared custody. The people need to get this right. By all means, you can have access. The custody is different from access. You said let's move away from that, but you are still doing on that. Let me bring the position of No. I just read the comment from Mrs. BB or something. So I'm just replying to that. Yeah. Sorry. Mm-hmm. Sorry, Papa, I'm listening to you. No, it's okay. Lord, you know I'm in grace.
Papayano, do I have the permission to ask this guy a question?
Why not?
Okay, thank you so much.
I didn't know you better ask me a question that I like. Okay.
Thank you. Well, I'm not gearing towards the paternity. I have a very. I want to ask a question. Do you think that a judge, there can be leniency? A judge can reduce sentencing to an offender based on childhood trauma?
Listen.
No. It's just a no. Listen, I'm not. I mean, I asked this question because I went back and I started to. I had a deep thinking.
Yeah.
And due to I don't want to go into anything. But I just want to ask you a question. Do you think a judge can reduce a sentence? Is it possible for a judge to reduce the sentence?
Let me tell you, from what I know, right?
Mm-hmm.
Here, that I've seen cases here, right? Mm-hmm. And even in Germany and in England as well. Mm-hmm. When it comes to trauma cases, mm-hmm. right? The judge, if you have a good lawyer, mm-hmm. that can prove that person has gone through a childhood trauma, mm-hmm. with substantial evidence, not just theoretical evidence now. Mm-hmm. Mm-hmm. Something you go to the doctor, you get it, like therapy and all those things. Mm-hmm. You get the shrinks, right?
Do you know about the Wummi case, the Wummi versus the Queen?
In England?
The Wummi case versus the Queen. No. In Australia?
No, in Australia, no.
Okay, so I'm not going to say this because of anything. Mm-hmm. But I think that there's a lot going on, and it's making me to rethink. So first of all, I came up with this because I know that a judge can actually reduce sentencing due to trauma. Okay?
A lot of
yes. Time. No, hold on. A judge can. So now the answer is yes, the judge can. So a sitting judge, as I know, can actually reduce sentencing based on trauma. If the trauma was diminished, if it diminished culpability of the individual involved. Let's say, for example, let me use the case of Mohbad. If this case goes to court, and from all that I'm seeing right now, I think I know where this is going, but I'm not going to discuss it on social media. If they can prove it, let's say, for example, it's determined that this lady was actually, that she actually committed this. She committed a crime. Let's say, for example, I'm not saying she did. Could she come back and tell the judge, I did this based on my trauma, based on my childhood trauma, based on how I was treated by my mother, based on the fact that my mother abandoned me, based on the fact that, according to what we are hearing from the sister, based on the fact that my uncle slept with the mother, and that traumatized me, and I couldn't think. Is that a possibility? No, hold on. No, hold on, please. Is that a possibility?
No.
Because
you're making sense. I'm just saying, you make me laugh.
You see, if you are a lawyer, you have to think out of the box. From where all this is going, I think I already know where it's going.
No, I thought about it as well. I question my mind all the time about what's been happening with Karimot stuff.
Okay, so now I think I already captured the picture.
And
because since yesterday I've been wondering, I think I captured what is happening now. Okay. So I'm just going to keep some information to I think I understand, what is happening. So now, if you look at the Wummi case,
okay, good,
right? If you look at if you look at the Wummi case, Wummi VR 2013 DPPV BW 207 RV AWF 2000. Wummi versus the Queen. You know, Bogmi, the Bogmi case was an Australian case. I think, the offender, hid under the, notion that, there was an abuse, there was an alcoholic abuse and violence in his household. Okay? So, and the case and the decision of the High Court, right, was actually set aside for the appeal. Okay? So now, I am thinking, because I've been thinking, what is happening? But that was why I wanted to bring it up to see if someone who committed an offense like homicide can actually use an homicide actually uses insanity. Okay? Insanity, as when they committed that crime, they were not in their right mind based on their background and based on the trauma that they had from childhood. Is that a possibility?
In normal circumstances, it is. And even given to the fact with the rumor that if she's pregnant, then that would be another strong point for a linear sentence, right?
Okay. So I think I rest my case because I think already.
Second point for
wait, let me read through your mind. Let me read through Adedoyin's mind. Adedoyin's kind of playing. Let me read through Adedoyin's mind. Okay, what's going on in her mind? She's trying to feel like, okay, Karimot is an instrument that is. This is my own perception, okay, not you. I'm just trying to read through your mind.
I never said that.
Okay. Now let me deduce some. This is what I want to deduce from your conversation. I want to deduce this. Now, there is a perception here that Karimot to ma ba sherelo, Karimot to ma ba sherelo. So there is a feeling here that Karimot is intentionally being used to cause fracas and to cause confusion, and as a result, to introduce like emotion, or introduce whatever would I say, a situation that is Wummi mother, Wummi father, our brothers and sisters, okay, which can be as an excuse for Wummi, okay, which will be later used for Wummi to escape through some certain, situations, some certain court procedures in the future. So when you kind of like saying that she knows what is playing through, is the perception that they are trying to prepare a defense for Wummi. But if that is the case, okay, that is easily struck out. First, I think there's going to be a DNA test conducted on Wummi mother and Wummi father. Thank God both of them, they are still alive. You go and bring both of them. You have to prove that, yes, that claim that you are making even existed. If I'm going to be the opposite lawyer, first we're going to establish that happened. Okay? If that is established, because they're not just going to forge it. If truly that is established and it can be proven, then we can now look at some ramifications, some implications, what that has cost, right? What are they doing? Does that make sense?
Well,
if it can be established.
Okay, well, I'm not going to speak for the deceased wife's sister, and that's no. I'm just thinking that if, from what I'm hearing, if that is the issue, could that have traumatized this lady called Wummi? Could that be a trauma for her? Could that have traumatized her? Because I'm not speaking on her behalf. Could that have, because I don't think like
you can speak on anything. Oh God, what big my tongue. She's a human being, please. You can speak on behalf of her when necessary. Yeah, we speak on behalf of everybody. If I speak on behalf of Bamba sometimes, it's because that is his human rights. Please, he's a human being. Don't do that. Okay. You can speak on behalf of her as a mother, and things that are right, you have to say it as a mother. Okay, where she's from, you have to take it through. Unless you're an enemy, potential enemy, I don't understand.
Okay, all right. Good.
Sorry, let me quickly interject you. Like what you're not getting the point Madam Adedoyin is trying to bring out from her statements earlier. Like if at all the asked Wummi was trying to tell the judge, oh, this is what actually happened that triggered me to take that action. Is there any way they can the judge can able to tell maybe like free Wummi or something? But the answer is no. Our lawyer can only appeal, and it's not left for the judge to grant it or not. Even if as that even if they appeal or do they not appeal, she has to face the law.
Okay, so
for action.
If I may speak to that, if I may speak to that, I'm not speaking on the fact that she should be either sentenced or not sentenced, or either. I'm not saying that she should be sentenced or not sentenced, but I'm looking at this case from a different point of view. Okay, I know I shouldn't be saying this on social media. I think I should be discussing it with.
What are you saying? This is an intelligent.
Hold on. I know what is so bad. Yes. I get it.
You are so conserved, and that doesn't.
I'm sorry that I am.
You have to say things that you have to say in an educational way. You should gauge it. You don't have to be telling us I don't have to say this. We don't look on educated like we don't have a hint, you know.
No, sir. I apologize. So now, I'm not saying that she should be either sentenced or not sentenced, but I'm thinking that if you look at her childhood, background, and a lot that we have heard so far, because I have taken my time to actually sit down. Why I'm not listening to Papariano, I go back and I listen to some things again. Could this have affected this lady in a way? Could her upbringing have affected her in a way to make decisions? I mean, like her going to the Malians.
Yes,
like,
it's part. Sorry,
it's
part of it.
I want us to look at this in a more educative way. I want us to take our mind. Hold on. I want us to take our mind away from her being Ashana, whatever that she's been called. I want us to really think about this and dissect it. Could it be that her upbringing constituted, or to her being at the Malians? Is this something we could look at? I'm not saying she should be free.
Let me please chip something in. What you're saying is very, very correct. We have those things everywhere in the world, right? Mm-hmm. They are coming from a very dysfunctional environment, I'll say, upbringing, family-wise. Mm-hmm. There's no two ways to say it, right? Both of them are streetwise, and don't forget, even in the middle of the hailstorm, both of them actually survived. Wummi is a graduate, by what I understand, right? Right. So she's learned it. But having said that, a childhood trauma in terms of rage, violence, when she's angry, from what I read so far, that will be part of it. When a child is traumatized, that's one of the reactive attitude. Honestly, we cannot put that aside.
Yeah, I'm not teaching the lawyers what to do, and I'm not advocating. Get that?
Sorry, Madam Ade.
But if she's proven guilty, mm-hmm. she will face the law.
She has to face the law.
And it's not down to the justice or to the judge or the jury to say, listen, based on this, so, from what I said, and that would be like kind of a plea bargain. Not by